We're here today to talk about an issue that's of critical importance to young people, children, pregnant moms in this state. We have got a situation where we've got something like 115,000 kids without health insurance. That means they're going without the critical treatment that they need. That affects all of us. It's not just an issue for poor people. In fact, what happens is that these folks are coming into emergency rooms. They're taking up beds and space in emergency rooms, affecting every one of our communities, everyone in our community. So what we're talking about right now is that in the Senate, in the Congress, they're debating an issue of critical importance to our young people and our moms. I want to thank our Senate Majority Leader, Harry Reid, for his leadership. I want to thank Congresswoman Shelley Berkeley for her leadership in the Congress in providing this critically important coverage for young people called SCHIP, and that stands for the State Children's Health Insurance Program. Right now we've got 25,000 kids enrolled in that program, but the problem is we've got 40,000 at least that are eligible, and there's no room for them. So that what they're debating in Washington right now is opening the doors and allow us to cover a few more kids, a few more moms, maybe thousands more. And what we're asking our folks to do, including Senator John Ensign, is get on board and support the needs of our young people and our moms-to-be. We've got a lot of folks here from different organizations that are interested in speaking, and I'd like to first introduce my friend Marco Rauda with Democracia Ahora, and he's going to say a few words about the importance
I'll start by saying my name is Marco Rauda. I am the State Director for Democracia Ahora. We are a nonpartisan Latino civic engagement organization. Just want to start by saying that last year, in 2008, I became a U.S. citizen, and it was a very special year for me. Like thousands of new Americans, I became an American citizen and voted for the first time. I'm worried though. I worry that thousands of children in Nevada might never get the chance to do what I did. Citizens and legal immigrants are being denied health just because they don't have cash up front. That's not right. That's not the America I love. We got thousands of pregnant moms and thousands of kids who need to be vaccinated, and who need basic nutrition, and most of all, who just need to see a doctor. If we deny them that, we will all suffer. Let's do what's right. Let's give the children of working families and all the kids in our state the health care that they need and the health care that they deserve. Thank you.
Next speaker was going to be my friend Nancy Whitman.
Nevada Covering Kids and Families helps parents who have uninsured children apply for Nevada Checkup, which is Nevada's state health insurance program. And so we work with working parents, and parents have to be working in order to qualify for Nevada Checkup for their children. Nevada Checkup is a very important program. There are many kids that are in our Clark County School District that are uninsured, and most likely many of those children could qualify for Nevada Checkup. Without health care and access to health care, children in this state are not able to learn and grow, and they impact the rest of us because they access inappropriate health care through emergency rooms. They can spread disease. They may not be up to date on their immunizations. So there's nothing more important than Nevada Checkup and reauthorizing SCHIP. And I know that there's many people, congressional representatives, that don't support expansion of the program or reauthorization, and all I can say is, in today's tough economic times, it's a program we need. And when our economy improves and parents make that transition with their children from Medicaid, then we need to have Nevada Checkup and SCHIP available for those parents and their children, because children are our future and they must remain healthy. Thank you.
I'd like to introduce my new friend, Esperanza. Esperanza has some direct experience with these issues, and so I'm really looking forward to hearing her story. Esperanza, thank you.
My name is Esperanza Cervantes. I am the proud mother of two boys, one 23-year-old that just came back from Iraq after servicing for over a year, and the other one who is 8 years old. He was born with Down syndrome. I can tell that we have fought many battles with my son, but one of the most critical battles that we have fought and we're still fighting is to obtain and maintain medical insurance for my son. And I'm the voice of thousands and thousands of families from Nevada, from Las Vegas, who are in the situation, where we can't even sleep sometimes, thinking that probably next month we won't be qualifying for the insurance because of the nature of most of the employment here in Las Vegas does not ensure a set income for the families. It varies month to month. So it is very critical that we get the reauthorization support for our children because they will be the future of our nation.
I'd like to introduce my friend Jerry Strasser with the SEIU, and she's going to say a few words from the perspective of a healthcare practitioner.
Thank you, Lon. My name is Jerry Strasser. I am a pediatric intensive care nurse at University Medical Center, and I've been employed here for 27 years. I've been a Nevada resident for almost 40, so I've seen a lot of things go on. SCHIP to me is all about access, and when we deny access, we're devastating families. We had a child of a working mother, uninsured, who went and took her child to the doctor for an earache. The earache was diagnosed, but the mother didn't have the money for the prescription. So she didn't fill the prescription. She gave her child Advil and did some stuff for her ear, but the infection raged on. The child developed meningitis and was admitted to the pediatric intensive care and put on life support. She was a member of a large family, and her sisters were in a convention in Utah. The sisters, hearing that their sister was on life support, got in the car, and the three of them started back to Las Vegas. On the way back, they got into an accident. One of the sisters died. One of the sisters was admitted to our trauma, and we still had one of them on life support. So the one in trauma had a severe injury. She was also, she would have been eligible for SCHIP. In fact, most of the girls in this family would have been. She ended up in trauma. We had both of the girls at one time, and they both have now are recovering, but one has severe disabilities. And this is a family that loves each other. It's a chain of events. It requires long-term rehab for both of the girls. The end cost of denying access for that prescription and covering that prescription has now cost the state of Nevada millions of dollars. We need to prevent this. We need to make our state great. We cannot stay underserved. We need to be better, and we can be better. So let's do the right thing. Let's support these programs and get these kids and these families the health care that they deserve. Thank you very much.